The hematocrit. Today we'll talk about hematocrit or packed cell volume. It's a quick way to determine the percentage of red blood cells or RBCs in the plasma. The typical normal values for hematocrit change from lab to lab, but basically the females are 36 to 46%, while males are 37 to 49%. Children will vary with age. Pregnant women tend to decrease in the last trimester as their serum volume increases, and newborns, they can be up to 60% hematocrit. But then again, lab values will vary from lab to lab. This is just general range. Typically, the phlebotomist would draw the CBC sample in a purple top tube. This tube has a preservative called EDTA that preserves the sample. What you see here are some models of hematocrit, different hematocrits. It's actually sand and water. The chunky stuff at the bottom are your RBCs. Can't really see the buffy coat that has the WBCs, which would be on top of the red blood cells, and then the plasma at the top. The plasma is where they would test for electrolytes like potassium, sodium, chloride, and so forth, calcium. So what you can see that, sort of see that each of these vials is divided into 5 little parts, each representing 20%. So this first one here looks like 20, 40, close to 50% of the volume is red blood cells. So the hematocrit would be 50%. In the second one, you can see that 20, 40, it might be just a little less than 40% red blood cells, so the hematocrit would be 40% in that one on the right. This third one, you can see at the bottom, the red blood cells occupy only about 20% or so of the volume, total volume of the plasma and red blood cells. So the hematocrit of this one would be 20%. And normal hematocrit in an adult would be, men are 37 to 49 and women are 36 to 46. Notice in this fourth sample here, it appears to have a very low hematocrit, less than 20%. But notice the color of the plasma. It has more of a reddish tint as compared to this other sample to the left, has kind of a amber yellowish tint. This is because the red blood cells during the draw, for some reason, were hemolyzed. The phlebotomist would normally recognize this and redraw the sample to get a more accurate result. Because the hematocrit is a proportion or percentage of the RBCs to plasma volume, and a decrease in the volume of the plasma causes an increase in hematocrit, even though the RBC count has not increased. For example, if the client is a burn, plasma can be lost in large amounts through damaged capillaries in the burned areas. The loss of fluid from the vascular space makes the blood very concentrated, and then hence the hematocrit could be as high as 60 to 65%. If the client's hydration status is normal, and elevated hematocrit could signify a true increase in the RBC count. Reasons for this could be, as we discussed before in the RBC one, is polycythemia. A decrease in hematocrit can be due either to overhydration of the patient, which increases the plasma volume, or it could be a true decrease in the number of RBCs. Low RBCs can result from abnormal loss of erythrocytes, such as in bleeding, abnormal destruction of erythrocytes, hemolysis, lack of the needed elements or hormones for erythrocyte production, such maybe in renal failure, or bone marrow suppression. Hopefully this video will give you a better understanding of hematocrit, the percentage of red blood cells in the plasma.